Hi, I'm Bons Magsambol, and this is Rappler Talk. The Omicron variant is sweeping across the globe and driving fresh surge in cases in several countries. What do we know about Omicron? Joining us today is infectious disease specialist Dr. Ron Jean Solante. Hi, Doc Jean. Welcome to Rappler.
Hi, Bonds. Good morning.
Okay. Siguro, let's start the discussion na. So, to start off the discussion, Doc Jean, what is Omicron and what do we know about this new variant?
Okay, so first we need to characterize now what's Omicron variant and what's the difference of this variant of concern with the other variants of concern, particularly Delta, which was the dominant variant before this Omicron variant. So this is the same virus that we have experienced for the past 2 years now, but this virus is quite unique with other variants of concern because of the mutations, the several mutations that was seen in the spike protein. And when I say several, in fact, most experts describe it as heavily mutated. 32 mutations in the spike protein. What is that? That does that mean? Meaning you change the outlook of the spike protein to the point that one, this virus is now more highly transmissible. And second, there is a high possibility that the antibodies we produce with vaccines or with treatment like monoclonal antibodies can evade with this mutation. So, in a way, those two very important factors can lead to more cases, can lead to more reinfections. And that's what we are facing at this point in time.
Okay, thank you for that, Dr. Jean. So yeah, you mentioned about the possibility of high transmissibility, and then it could possibly evade vaccine efficacy. So let's go deeper into that. So for my second question, how transmissible is Omicron? And siguro let's compare it with Delta.
Okay, so if you look at Delta before, we said that with a single interaction, you have that possibility of like infecting 5 to 8. Now, experts believe that because of these mutations, a single individual having Omicron variant can infect twice that or even 3 times that of Delta. So if you look at like in a one room and you have an individual having an Omicron variant, you are 30 in that room. So that means double the Delta, 5, 10, 8, 16. So that means there will be people that will be infected with that single interaction with that individual having Omicron variant between 10 to 16 in that particular room. And that's how easy that this virus can transmit to an individual.
Okay. Right. So masyado talagang transmissible to in terms of like imagine it can infect up to 16 people. Okay. Yesterday, December 30, the Philippines reported 1,623 COVID-19 cases. This is the highest in over a month when we were just recovering from Delta. Okay, some experts say this is could be just a holiday surge because people are more mas gumagalaw sila, mas lumalabas sila. But can we say that yung na-experience natin na spike in cases for the past days is due to the presence of Omicron?
Well, for me, the experience with other countries, okay, when they had Omicron, the most important character that they observed was the rapid increase in number within 24 hours. So after 24 hours, there was 2 or 3-fold increase in the number of cases. And if I'm going to correlate this with our experience, then most likely it can be Omicron. Why? Most of us already in Metro Manila are vaccinated. So that means that we should be protected with Delta. But why are we still getting most of this positive? Second, uh, again, the character compared to Delta, very transmissible, and you have this number from 800 and jump to 1,600, then most likely that can be. These are important characteristics that we can compare it with other countries and can also be an Omicron variant driven jump or surge of cases.
Okay, right. So the Philippines now has 4 cases of Omicron. So all those four detected are imported cases. So the Department of Health has not yet been declaring local transmission of the said variant. So do you think the Philippines is sequencing enough samples to detect the presence of this variant?
Okay, so I would like to specifically explain on that. No, that's a good question. Are we sequencing enough? Now, I think the more important question is, do we have the ability to sequence all samples? Okay,
Oh,
because when you look at the way we are sequencing samples, it's random. So that means that not all samples are sequenced, which is also correct in some other countries. Like in the standard of genome sequencing, we should be sequencing like 10 to 15% of the total samples that are positive. Now the question is, are we sequencing all of this 10 to 15%? So that's the other question. Now, the second one is that our Philippine Genome Center is able to sequence a lot of the samples in terms of capability. So for me, I cannot answer that because I don't know how the Philippine Genome Center, what are the numbers of samples that they receive and how many of these are sequenced in 24 hours or in a week. So for me, I think I cannot answer that, but we are in the right path in terms of doing the sequencing for all samples, for samples that are especially for returning overseas OFW, which is the priority for genome sequencing.
okay, right. So, okay. So in terms of Delta, Department of Health had said that we were somehow delayed its entry to the Philippines. How would you assess the Philippine government response when it comes to this Omicron variant? Because as we all know, the Omicron has been around since early November in some, of course, in some African countries. And how would you assess the Philippines' response when in terms of this uh, variant?
Well, I think our response is just adequate, okay, because after the declaration of the WHO that there was Omicron variant and it is a variant of concern, I think 2 to 3 days after, our government already implemented the travel restrictions and the travel ban, especially for countries who are reporting an Omicron variant where there is already community transmission. And second, we follow the protocol in terms of quarantine procedure that everyone coming in from those countries that we are allowed to travel here should be having an RT-PCR 72 hours prior to arrival, and then on the fifth day, they will have again an RT-PCR, and they have to complete the quarantine procedure for 5 days, and then the remaining 9 days will be at home. So for those who are asymptomatic. So I think for me, our response is just adequate because we focus on border control at that point in time.
Okay, right. So, do you have any suggestions on what the government should be doing now that we have detected cases of the Omicron in the country?
Well, for once, the government should again enhance our border control. We need to do more testing. Okay, and one of the important gaps in testing is that uh, when we have individuals or population that are symptomatic at this point in time, testing they may not go for testing because it's expensive. We need to have the testing highly accessible, and it should be free. I think no, it should be free because as of now, the only testing that should be free if you are symptomatic. But what about those that are asymptomatic and close contact of those who are positive? I think there are areas there that why people are not into testing because of the cost of the testing. So very important. The other part there is uh, we need to enhance and strengthen our health facilities. Okay, and we have experienced that before when we have the surge. We need to extend our bed capacities at the expense of low numbers of healthcare workers. So the government should do something in augmenting the healthcare workers aside from enhancing the facilities. So that's the end. That's the part where we badly need the support of the government, especially the support of the government for the private hospitals and for the government hospitals, especially now that there are possible scenarios that some private hospitals will disengage with field health. No, and when you disengage with field health, if we will have more cases of COVID-19, I don't think the government facilities can address this. We need also the private hospitals to help us, and this is where that if a patient will be admitted and there will be no field health, he will be spending his own money to be admitted in a private hospital.
Okay, right. So, Doc Jean, you mentioned about the accessibility of testing. So, in some other countries, di ba, parang they could just buy testing kits, antigen testing kits in some pharmacies, di ba? Parang the government has been distributing test kits to its population. Uh, what is your opinion? Like for example, meron bang possibility na sa Philippines maging accessible yung antigen testing kit sa mga pharmacies natin? I know ngayon, pwede mo siyang bilhin sa mga, like for example, sa Watson, pero kailangan pa rin kasi ng prescription ng doctor, ng medical doctor if you're going to avail of the testing kit. Meron bang possibility or may dadating ba tayo sa time na yung isang individual can just buy a testing kit in pharmacies?
Yes, I think no, that's one important strategy that we allow anybody, even without the prescription, to get the testing kit and have himself tested or any family members, because that's the other way we can enhance our testing, and we know that how many of those are infected. It's just a matter of educating the public and giving them guidance on how to do this test and how to report when they will be positive. No, and for me, it's important that testing should be highly available and highly accessible also.
Okay, right. So let's go now to the vaccine kasi you mentioned din kanina na itong Omicron could evade vaccine efficacy. So ito yung question, actually ito yung question ng nakakarami. Effective pa ba yung mga vaccines na meron tayo ngayon against Omicron?
Okay, so first thing first, no, when the vaccine expert panel recommended for the booster, that was intended to sustain our protection against the Delta. Okay, so we recommended for the booster 6 months after the primary dose. Now, when we have Omicron, and the data tells us that it reduces the effectiveness of these vaccines 20 to 30 times, 20 to 30% lower compared to the Delta variant. So that means most of these vaccines, when you are receiving a primary vaccine series, may not be working at all at this point in time. So that's why the government shortened the interval, because the data will tell us that if you give the third dose earlier, you maintain the protection, and in fact, you still have a very good protection against the Omicron variant. Okay, so the question is how high and how effective this vaccine, even with the booster dose. So for me, and based on the data, it is still effective with protection as high as 70% to around 75%. Okay, if you receive the booster dose, particularly with the mRNA vaccine, with the virus vector vaccine like AstraZeneca and the J&J vaccine. Okay, the only question then is that with that protection, can it hold through in terms of protecting us against severe disease? Okay, the current uh, uh, opinion of most experts, because vaccine does not only produce a neutralizing antibody, it also stimulates our T cell, and the T cell response with vaccine is the more durable protection that we get from vaccine, so that we will not develop the more severe infection. And most experts believe that even with Omicron variant, even with decreasing ability of this vaccine to block the Omicron variant, but the protection against more severe disease, hospitalization, and even death will still be there with current vaccine, even with this Omicron variant.
Okay, right. Okay, this is the last day of the year, December 31, and the government failed to meet its target of inoculating 70% of the eligible population. Doc Jean, what do you think the government should be focusing on in terms of vaccination for the coming year?
The government should focus on vaccinating everyone. Okay, when I say everyone, every individual in the Philippines. Now we have approved the 5 to 11 years old. We need to focus on the 5 to 11 years old. We saw the report in the United States and in some other countries, children less than 11 years old increasing in hospitalization. Okay, so once we get to the new year or the next this coming week, the government should now roll out the 5 to 11 years old, continue giving the vaccine to the vulnerable population. I think the data is that there are still a lot of those vulnerable population, the 60 years old, that hasn't been vaccinated, around 1.8 or 2 million. And this will be the vulnerable population that if the Omicron will hit us, this will be the number of the cases that will really overwhelm our healthcare facilities. So we need to enhance our vaccination. If everyone is a candidate already for the booster dose, we shorten the interval to 3 months. They should be getting the booster dose so that we have a very stable protection even against the Omicron variant of concern.
Okay, right. So let's go now in terms of hospitals, yung response ng mga hospitals natin. So some hospitals, private hospitals to be specific, have already reported spike in admissions for the past days. So this is relatively small pa compared to the spike in admissions we experienced with Delta, with the peak. So yung question ngayon, will we be experiencing the same surge of hospital admissions just like the ones we experienced with Delta?
Given the fact that our vaccination rate, especially outside of the national capital region, is still very low, we still can experience the surge that we experienced in March and in August. Okay, and this is what we'd like to emphasize, that for the hospitals, that there is a possibility that there can still be a higher likelihood that our healthcare facility can be overwhelmed, okay, until such time that we reach 80 to 90% of the vaccination rate. So that possibility and that uh, scenario can still happen, and that's why we need to prepare, especially the healthcare workers, including the facilities in the days to come.
Right. So Doc Jean, itong question na to, most people now are experiencing flu. 'Di ba? Maraming nagre-report na inuubo sila, sinisipon, tinatrangkaso, and then ito din yung questions ng mga nakakarami ngayon. Does Omicron have different symptoms compared to other variants, or may kakaiba ba ito na simptomas na wala sa Delta, for example, or sa other variants ng coronavirus na na-experience natin before?
Now, the experience, the data coming from UK, from Scotland, and from US indicated that for those who had mild symptoms, they usually present with just a stuffy nose, a sore throat, or some form of body malaise, no, or myalgia. Okay, and that's the most common manifestation. And mostly these are quite different from that with the Delta, because most of those when we had Delta are really in the moderate and severe. Now, we also cannot discount the possibility that when you are a 60 years old or a highly vulnerable individual, there's also a possibility that you can have a more severe form of the symptoms, as we have experienced with Delta in this Omicron variant. So even if the message here is, even if we do have a very mild symptoms, you should not neglect it. Okay, we should isolate ourselves, we should be testing ourselves, so that we should know if we will be positive. We should be contact tracing everyone in the family or those in contact with that positive, so that the part here is that if you have a highly transmissible variant of concern, there's still a possibility that it can overwhelm the healthcare facility because a lot of us will be sick and a lot of us will be seeking consultation in the hospital.
Right. Okay. So to wrap up our discussion, Doc Jean, the pandemic seems to be a cycle where we recover from a surge in infections and then we discover a new variant. So what's next for the pandemic and what the public should be doing now?
Okay, my thought on this, no, if we can control the Omicron variant at this point in time by vaccinating everyone, by preventing the transmission, then there will be no more mutations. The less likelihood that there will be mutations. Okay, and the prediction there is that we can end the pandemic by early 2023 as long as there will be no more mutations. So this is very critical for the nation. Okay, that we need to accelerate our vaccination program. We need everyone to be vaccinated because number one, the only time that a virus can mutate are only in people that are not vaccinated, especially if they are immunocompromised. So if we get all people to be vaccinated, including the immunocompromised, then less likelihood that we'll be transmitting the virus, less likelihood that there will be mutations, and hopefully all of us will be able to be protected against the circulating current variant of concern and not think of another variant of concern since we are already vaccinated.
Okay, thank you so much, Doc Jean, for joining us and for this insightful discussion. So that's it for today's episode of Rappler Talk. Again, I'm Bons Magsambol. Thanks for tuning in.